All right, so far, everything I've talked about is just kind of like normal aging. That's what will happen to most people, regardless of if you have some actual, chronic health issue or something like that. 85% of middle-aged Americans rate their health as either excellent or good, but you do start to develop more chronic diseases than you had in early adulthood. There are gender differences in the rates of death and illness that come with this middle adulthood period. Men tend to suffer more fatal illnesses than women do, but women tend to suffer more non-fatal, kind of debilitating chronic long-term health issues than men do. And in addition, most of the research that's done on health in the midlife is done using male participants. Part of that is to avoid, people who are pregnant. In a lot of, clinical studies and stuff, they exclude anyone who's pregnant or may be pregnant. And so one way that they get around that is just to only include men in their studies. And so especially historically, a lot of the research done on, medications and chronic illnesses and stuff have used primarily male participants. And that's problematic because of the way that males and females, go through illnesses, and also even the way that they digest and metabolize medications are very different. So there's really insufficient research on women and also ethnic minorities, because again, most of the participants in these research also tend to be Caucasian. There is increased studies using women and ethnic minorities, but historically there just hasn't been as much data. Some of the illnesses and disabilities that develop in middle adulthood, cancer is a pretty big one, so you have a really increased chance of getting cancer during this time. I'll talk about that more in just a minute. Cardiovascular disease is another. So those are the two leading causes of death in middle adulthood. You also have falls resulting in bone fractures. Those more than double. As I talked about, that's partially due to the bones being weaker. It's also because of changes that happen in balance and motor ability. So you're more likely to fall, and when you do fall, you're more likely to break a bone. Just like with all the other time periods we've talked about, economic disadvantage strongly predicts poor health and premature death. So people in low socioeconomic status situations tend to have more of these chronic illnesses. And also, like all the other time periods, there's this close connection between psychological and physical well-being. So people who tend to have a lot of stress and anxiety also tend to experience more physical health symptoms than those who are more psychologically healthy. So like I said, cancer and cardiovascular disease are the two leading causes of death during this time period. Cancer in middle adulthood, there's about 10 times more cases of death by cancer in middle adulthood compared to early adulthood. So you have a pretty drastic increase in rates during this time. 1/3 of US midlife deaths are contributed to cancer. There are more men who die from cancer than women. Also those who are higher in low socioeconomic status, there's higher rates of cancer in those with low socioeconomic status, but that varies by the location. Cancer results from basically mutations in the cell that can occur either in the germline or in somatic cells. So basically what I mean by that is you can either inherit genetic predisposition from your parents, that would be germline mutations, or you have somatic mutations, which is where any other sort of cell in your body just sort of randomly has a mutation that then multiplies and carries that mutation with it. And there's kind of 3 different types of genes that contribute to the chances of developing cancer. Some are called oncogenes. These are basically genes that directly cause the cell to duplicate abnormally. So basically with cancer you just have a cell that's multiplying way more than it should, and so it grows kind of like a tumor or a lump that shouldn't be there. And so oncogenes basically directly tell the cell, okay, you're going to keep multiplying even though normally they shouldn't. In addition to that, you have tumor suppressor genes and stability genes that are more indirect. The tumor suppressor genes, as the name implies, are genes that help protect against cancer because they basically stop these oncogenes from going out of control. And so if you have mutations in the tumor suppressor genes, then you're kind of taking away one of these protections, and then you're more likely to develop cancer. Similarly, stability genes basically fix damaged DNA, so they repair any damages to it. And so if you have a mutation in the stability genes, then you're no longer getting those repairs in the DNA, and so you're more likely to develop cells that are now going to duplicate abnormally. So the point is there's multiple ways you can get cancer. We probably all know there's multiple types of cancer. There's not really like one treatment method that's going to work for all of them. They all have different sort of pathways. Often cancer, though, is curable, so about 60% of people survive the 5 years or more. However, survival can often bring its own challenges. So there's emotional challenges. It's just dealing with the fact that you faced death and came through it can be very difficult for some people to cope with. There's also often financial difficulties. If someone went through this and had to, pay a massive amount for medical expenses, particularly if they didn't have insurance or good insurance, then they may, suffer with medical debt for the rest of their lives after having dealt with this very difficult emotional battle. Probably all of these, for reducing cancer risk, all of you probably know and have heard, but I'll just go through them anyways. One of the most important ones I would say that you maybe don't know is knowing the 7 signs, the 7 warning signs that you may have a type of cancer. So the 7 warning signs that they say to look out for, one is if you have sudden changes in your bowel or bladder movements that aren't explained by something else. If you have a sore that won't heal, continues to bleed. If you have unusual bleeding or discharge, thickening lumps in the breast or other areas of the body, indigestion and swallowing difficulties, a change in a wart or mole, and also like nagging, cough, or hoarseness. Those are supposed to be the 7 kind of prominent signs that something may be wrong. And so most doctors say, if you experience any of those symptoms, you should probably go see a doctor and get things checked out. In addition to that, getting regular checkups and screenings that are appropriate for your sex and age. Women are supposed to get pap smears and mammograms about every 1 to 2 years, depending on your age. I think most people get pap smears starting, pretty early, but you're supposed to start getting mammograms around 40 to search for breast cancer. Men are supposed to start getting annual prostate screenings around age 50, and both men and women should get periodic screenings for colon cancer in this middle adulthood phase. And then, of course, obviously eating a healthy diet, maintaining physical activity, and avoiding, drugs and alcohol, things that we know contribute to increased risk of cancer. So tobacco, excessive sun exposure, unnecessary x-rays, industrial chemicals and pollutants, and then excessive amounts of alcohol. All of those have been shown to contribute to risk of cancer. And then I kind of alluded to this earlier, but if you're going through menopause, you're trying to decide, should I, go with hormone replacement therapy? Just know that, one of the risks of that is all kinds of chronic health issues, including things like uterine and breast cancer. And so weighing those risks is really important. This graph just shows a breakdown of the most common types of cancer. For men, the most common is prostate. For women, it's breast. Both men and women have about equal rates of lung cancer. And then colon and rectum cancer are the third ones. So those are the 3 most common.